very much, and welcome everybody. First of all, I'd like to acknowledge Shane for his support throughout this. He has been a strong supporter of mental health in this area, and it's unfortunate that he can't stay with us. I'd also like to acknowledge Ian Barry, who's a state member here. Ian, I've met with him on a number of occasions. Ian is a very strong supporter of the mental health non-government sector in Ipswich. He's certainly been very supportive when we were looking at establishing both Headspace and Partners in Recovery. So Ian, thank you very much for all your support. Mayor Lehman, I'm not sure if he's arrived yet at this stage, but certainly some of the regional councils around Ipswich have been very supportive and really sort of keen to look at the mental health needs in those communities. And Councillor Ireland, who said she would be here a little bit later, similarly has a strong interest and passion in mental health. I suppose this is a unique opportunity for us in West Moreton. West Moreton is a unique location. As I think Shane said, but we all know, has a range of Indigenous, multicultural, lower socioeconomic class communities. We also are one of those regions where we've had a long-standing psychiatric hospital in this particular region. So I think keeping a lot of those things in mind when we think about mental health is important when you think about Partners in Recovery and what potentially Partners in Recovery can do when it comes to the West Moreton region. I'm just going to go through some of the technical aspects of Partners in Recovery just to bring everybody onto the same page, because what's really, I suppose, encouraging here today, that we don't have the normal mental health organisations in the audience, on their own talking about mental health. We've got people from a whole range of backgrounds, which is what Partners in Recovery is about. For example, I've just had a brief discussion with people from the RSPCA who have a particular slant around Partners in Recovery, mental health issues, etc. So we need the broader community. Partners in Recovery is about the broader community. It's not just about mental health services, and I'm sure Helen and others will talk more about that, but it's really about, I'm really glad and pleased to see that it's not the usual faces in the audience, that there's a whole range of additional faces in the audience who really see mental health as an important part of what they do. Just quickly, Partners in Recovery was established to support people over 18 years of age who have a complex, severe mental illness, who have what we call multi-agency needs, but who continuously fall through the service gaps. The problem with that is that governments of all kinds of persuasions have been investing in mental health and health over a number of years. And I was part of some of that over the last probably 20 years, and you continue to invest more and more resources, but you talk to consumers, families and carers, and they will tell you very little has changed. So I think we need to step back and think about what could we do differently. And I think Partners in Recovery offers us that opportunity to look at things differently. We have a unique opportunity through this particular program to support at least 390 people who fall into that really sharp end, complex end of the spectrum. 390 people. And the Commonwealth tells us, which I will question, I'm sure some of my other colleagues may as well, that that's about 40% of the people who fall into that category in the West Moreton area. I think we've probably got more than that in terms of the people that need this level of need, but at this stage we have been asked to support 390 over the life of this program, which is 3 years. But I think more importantly, yes, we need to support these individuals, but I think the key to all of this is about, and I'll read this because I think it's important that people sort of try and remember this, it's about identifying, designing and implementing mental health services reform in this region. It's about the reform of the system. It's change. It's not more of the same. So while at the same time we're supporting 390 people eventually, we also are working at changing the system. Consumers will tell you more of the same, no thank you. We need to think about what does that mean in this environment. Some interesting objectives, and you've probably heard these words, they're buzzwords, and I think we've all used them over the last, at least in my life in mental health, well over 20 years, we've all used these words, but I think Partners in Recovery provides an opportunity to actually ground these words. Get people connected and help them stay connected. Co-design, referral, access pathways. I'm sure you've heard of all of this. Integrated care. Promote a community-based recovery approach rather than just around clinical symptoms. Coordinate. existing services we have in the community, with the public mental health system, with general practice, with a whole range of players. And look for new partners in this journey. If we continue just to look internally, whether it's just 10 of us agencies that are involved in this Partners in Recovery and Health and Medicare Local, if we just look internally and say we can do this, I think we've lost the battle. I think it's much, much broader than that. The literature certainly indicates that, if you look at the rationale behind Partners in Recovery, the literature indicates that obviously the prevalence of mental illness is on the increase. And it depends, you can talk about the sort of more high prevalence disorders versus more the chronic illness, but overall it's on the increase. And if you combine that with population growth of Australia, we think the need will increase by over 100%, say within the next 15 years. What are we doing to prepare for that? Is it about more services, more of the same, or is there a different way we can do this? If we continue to do what we're doing and don't change anything, we're going to need an additional 4,500 general practitioners, 2,100 psychiatrists, and over 2,000 clinicians, psychologists, social workers, etc., etc. Is that the way we want to go? Not that I don't think we need those people, yes we do, but is there a different way to do that? And particularly when we know, about the workforce shortages, not just in Australia but overseas, how are we going to do things differently? For us at least in Aftercare, and I think the partner organisations that we're working with and our colleagues in health and Medicare Local, etc., is that the message is clear. We need to do things differently. And I think we're pushing ourselves really hard. And I have to say that, particularly Susan has had a tough job, because when you're driving change, you're going to put people off. And I can tell you, when you're driving change, not only are you putting people off in your own organisation who aren't ready for change, but you're putting a lot of external partners potentially off because they're not ready for change. But we make no apologies. I think the colleagues that we've got in Partners in Recovery are willing to take the challenge and challenge people around the importance of change. Now we know that, the quality of care generally, if you look at all of the evidence, has improved. But also that data indicates that 40% of people with a severe and complex mental illness don't access any services. I'm sure that Helen Glover will say that's not a bad thing. And maybe that's not a bad thing. But there is still a substantial amount of people that need a whole range of other supports and things to be able to live meaningful lives in the community. We know that particularly people who have comorbid problems such as substance abuse, poor physical health, long-term unemployment, etc., are even worse off. So what are we doing about it all? This is the questions we need to ask ourselves. We're no different anywhere in the world. People are talking internationally. There's high rates of readmission of people to hospitals. There's an increase in involuntary treatment orders. There's an increase in the number of people who need to be supported by police. And there's a disproportionate number of people who are homeless with mental illness. No different for us here in Westmoreland, no different for us in Queensland. That's the international issues that people talk. If you look at all the reports, we'll identify most of those issues as being major. We need a coordinated response to recovery, and I'm sure that Helen will unpack this for you much more. But this means that particularly for us who historically have just seen our space as mental health, that we need to work much more closer, hand in glove, as I think people have said, with housing, with transport, with employment, with education, with family support, with child safety, with justice, with police, and I can go on. How do we get those agencies, those players, to see that they have a role in mental health? Not only that they say that they have a role, but in actual fact they're actively involved in mental health. That's the challenge, and I think that's what Partners in Recovery is about. The bit of, I suppose, evidence that came out of Partners in Recovery, evidence when we were developing Partners in Recovery, even before I came to the non-government sector, was very clear. A person with a mental health problem, a severe complex mental health problem, will have 20% of their needs will be what I will call pharmacological clinical. Pharmacological clinical. 80% of their need will be what I will call psychosocial. But if you look at our investment in our system, and not just in Australia, but most Western systems. The investment is the other way around. We in Australia invest, and I'm going to be quite generous here, we invest approximately 10 to 15% in the 80%, which is the psychosocial, and we invest 85-90% into the 20%, which is pharmacological clinical. I'm not saying we don't continue to invest in clinical services. Yes, we need to, but we need to get a better balance. People need a whole range of other supports, so they, as one consumer put it very nicely to me when I was doing some consultations recently, she said, why do all roads lead to inpatient care? The key is we need to provide supports for people in the community to live meaningful lives. Really, Partners in Recovery is about gaps. Now I know a lot of people say, why is government funding, someone to fill the gaps? Because I think from a government perspective, and having spent a lot of my time and heard a lot of ministers and MPs and DGs, etc. speak, we continue to invest in the system, but the silos continue to be there. PIR is meant to be the glue. Apart from supporting these complex individuals, it's meant to be the glue that brings all of this together. And we can't do it. Even the 10 partners around the table with us, we can't do it on our own without you. We cannot do it on our own. So if I just read this, I think this is important for you to sort of understand, because we grapple with this really hard. So in line with the PIR program objectives, we are continually assessing how we can improve the systemic response for people with mental illness. Nothing new, but that's what we're trying to do. Secondly, we're trying to extract more value out of our existing resources. More value out of our existing resources. Aftercare is the same as anybody else. You look after your own patch. That's not what this is about. We need to push ourselves to say, how can we get better value from the resources that we've got individually when we combine them? And finally, which relates to that point, is we need to look at ways to find new forms of value that can be created, that can create new healthcare outcomes. So how do we do that? Form new values from the resources that we have. Really challenging stuff. Again, we're no different. But the sort of recent report from the World Economic Forum highlighted the need for countries to reorient their healthcare delivery to wellness support models based on supported health maintenance and enhanced self-care. Nothing new. But the challenge for a system, and I've been in the system for a long time, is how do you move that shift from a system that needs resources, move that shift to a wellness model? That is not easy. The words are easy, but the system change is difficult. We are no different in the West Moreton area. We've got our own challenges. So how do we change the DNA of the West Moreton community, the mental health sector, the broader sector, to genuinely see our people as assets rather than needs? This is our challenge. But I think together we're ready for it. But on the other hand, I think we're also in a very fortunate community. West Moreton is a phenomenal community. There is a general and genuine acceptance that we can't do this on our own. So I think the buy-in every day is greater and better. We have a range of rich organisations, individuals, players in this region which we need to call upon. And I think we have the expertise to achieve this change. I don't want to sound pessimistic because I'm very optimistic and I think we can do it. In sort of trying to conclude this, for us, the task ahead requires mental health service providers and the broader industry and the broader community to work with all of these agencies in Partners in Recovery and us working with you to unlock the potential of multiplying the value community can offer to people with mental illness. To unlock the value community offers to us, rather than relying on the system. And I think that's a major challenge. Our job in PIR is to try and work with you to unlock that complexity. There is a complexity. You talk to people with mental illness, they will talk to you about the complexity. 50,000 intake processes, assessment triages, 50,000 care plans. I've had to tell my story 50 million times. to 50 different people. That's what we're trying to unlock. I'll finish by saying, again, this would not be possible without Susan and her team and the leadership and management, and I know she from time to time would have stepped on people's toes, but change both within Aftercare and externally is not easy, and we make no apologies for that. I'd like to particularly thank our partners. We've got some phenomenal organisations with history. I know Aftercare's got over 100 years, but if you add all of our history, we've got well over 250 years of experience of working in mental health. If we can't, with your support, achieve some of this, then I don't think there is many regions across Australia that will be able to achieve this. The other advantage that we have, we've got a Queensland health system headed up by Leslie, Sharon, Leanne, Michelle and others who are interested in supporting the change. You don't always get that in very many districts. This team, this leadership in Westmore is interested and genuine about change. We've also got a Medicare local here who took a very different view about mental health even from the outset. And Sue and her team have been supportive throughout this. And again, that primary mental health care sector is so vital. But finally and fundamentally, it's you that are most important. If it's still all of us 10 agencies working on our own in our own little patch, then I think PIR will come and go and people with mental illness will not see much of a change. Maybe some of those individuals that get support during this period might see some change, but I'm not sure we'll see system change. With your help, with your support, with your buy-in, I think PIR and the whole system in Ipswich will change for the better of those individuals living with mental illness and their families and carers. Thank you.